Welcome to the More Than Scrubs podcast, a podcast where dentists and healthcare professionals can learn how to thrive in or beyond their 9-to-5 job. I mean, don't get me wrong, I love my scrubs. But in this podcast, I want to explore how we can build a side hustle, a business, or excel in our careers so that we can have that work-life balance that everyone's always talking about. Healthcare careers have evolved so much in the past decade, so let's find a way that we can evolve with them. My name is Dr Kamal Chopra. I'm a dentist, a business owner, and I want to take you on this journey with me to find out how we can be more than scrubs. So let's dive straight into it. Welcome back, everyone, to the More Than Scrubs podcast. I've got the lovely Fran here today. Fran, if you'd like to introduce yourself.
Hi everyone, I'm Fran. I graduated from Leeds in 2016. I then moved to London. I've been in London for 9 years now, and I'm now a specialist in prosthodontics.
That is amazing, Fran. So the purpose of this podcast is to learn how to be more than scrubs. So you're a prosthodontist, you still work in your scrubs, but you figured out a way to do more than just general dentistry. So I'm really intrigued to hear about your journey.
Yes.
Did you always know you wanted to be where you are now?
Absolutely not.
Okay.
So I think when I decided to do dentistry, I don't think I quite comprehended exactly what dentistry is. And I do remember I did some work experience before I got into dental school, and it was quite a well-known cosmetic practice. And I remember watching him do sort of a smile mock-up.
Mm-hmm.
And I remember thinking, whoa, that's insane. And the reaction of the patient. And I just thought, that is incredible. I'd love to be able to do that. And then you go to dental school and all of that goes out the window, and you're learning about your perio and all your basics, caries. And I really struggled, and I was doing well. I did fine at dental school, but I always had a bit of an internal battle with myself. I'm not good enough, and I didn't enjoy dental school. But then when I got to final year, I had an amazing tutor, and I had a complete case, which I weirdly really enjoyed doing. And he was an amazing patient, and it went well. And I also got a toothware case, and I remember I was a bit of a keen bee, and I really did work hard, and I did a composite course of Andrew Chandrapal in my final year, because I thought, I've got this toothware course, I need to be able to do my composite build-ups nicely.
In your final year?
Yeah, I know. Wow. I'm a bit of a weirdo like that. So I really tried hard, and it was those two cases that I thought, quite like this, but I still lacked a huge amount of confidence. So when I did VT, I hated VT absolutely with a passion. I wanted to quit, really struggled. I made some amazing friends in VT, and that's what got me through the year, and it was my relationships with people. But I then did a DCT job from the pure fact I didn't think I was good enough to go into practice on my own. I just didn't have any confidence, and I thought, I can't be let loose in practice. I need some sort of tuition. So I was really lucky to get a restorative oral surgery job at Guy's. It was an absolute shock. I went for the interview, and I had to do all my choices for the jobs. And I remember doing it in the pub at the Blind Beggar in Whitechapel, because my study days are at Barts.
Okay.
So I was sat by this carp pond in the Blind Beggar, literally with 30 minutes to go, and I was like, oh God, what do I do? And somebody said, oh, Guy's is good. So I thought, oh, put Guy's there.
Who were you with?
And I was with all my VT lot, my friends, who I'm still really good friends with. And yeah, I got a Guy's job, and it was from that year that I realised, actually, I really like prosthodontics, and I didn't even know you could specialise in prosthodontics. Leeds was an amazing university, but you don't really work with specialists. The consultants are very separate. You do get to work with the peds and the ortho specialists, but for restorative, we weren't really exposed to it. So I didn't know you could really specialise in that. So it was on my Guy's job, and working with a really amazing specialist in pros, female specialist in pros, that I thought, maybe this is something I'd like to do. So yeah, that's how I got into pros, really.
That's fantastic.
Yeah.
That's fantastic.
So not planned.
I feel like it's quite early on that you realise that prosthodontics is something that you want to do.
Absolutely. But it was more, again, I didn't want to be a specialist. It was more, I want further training in this. I want further sort of hospital supervision. I didn't feel confident enough to go out and practice, do a course and just do some big cases myself, which a lot of people do, and fair play to them, but I'm just not that sort of character. So yes, I become a specialist, but it was more from a sort of an insecurity of mine, if that makes sense. So but actually I like, I'm not being big-headed, but I'm good at what I do.
Yeah.
And I think I've always underestimated myself. So, but it's nice. I don't think if I hadn't have done that, I don't think I would have done this training pathway. So, yeah.
I mean, you really used your insecurities to your advantage in a way. That's amazing that you did that. So what in your DCT 2 year, was it DCT?
Just 1 year,
yes. What really stood out to you that made you want to pursue this as a speciality?
I think... So there was pros and cons to the job. It was quite an easy-ish job in general, but there was one treatment clinic with one supervisor. She was called Dr Zuleika Berkey, and she was a specialist in prosthodontics who did her training at Guy's, but she's actually moved back to Pakistan now, and she was just so fierce and amazing and just incredible at what she does. And I was low-grade terrified of her, but I loved her. And I just really looked forward to the treatment sessions because I knew she would push me in a good way. She would listen to me talking to patients and she would take me aside and be like, Fran, what was that? What was that? Be more confident. She'd really push me in a really good way.
Yeah.
And I just asked her one day, I was like, where have you got to, where you are now? What have you done? And she said, oh, I did the prosthodontic implant dent. And I thought, I want to be like her. So, and I did a couple of implant cases of her, just restoring them, and I loved it. And that's something I do most of the week now. And it was from that little moment with her a couple of times that I thought, I want to do this.
Yeah.
So yeah, that's it.
So it's really nice to have somebody that you can kind of ask questions, follow their footsteps in a way.
Yes.
So a mentor.
Yes.
And do you feel like you had to search for her, or she was kind of there because you did your DCT?
Yeah. I had no mentors.
Yeah.
I did well in my VT year, and look, my VT trainer was very busy. He didn't have a practice manager. He was running a practice by himself. He was always very stressed. So I didn't really class him as a mentor. But from my Guy's job, there was a couple of consultants who sort of really looked after me and would give me advice and career advice. And now in practice, I've got mentors, which I'm really grateful for. It was just more I've stumbled across them. Okay. I've not gone out to search for them. I've always just took every opportunity that I've had and things just fall into place.
Okay, so sense. I want to find out more about that because when people say stumbled across a mentor, that's fantastic.
It is,
but not everybody gets that.
Yeah.
So how can somebody actively find a mentor? So you think, okay, I want to do this speciality in pros.
Yeah.
How do I find somebody that I can kind of, be mentored by?
Yeah. In terms of getting in, just in practice or getting to specialist training? Or a bit of both?
Honestly, I think it's more that I think some people listening might think that they just have no help or direction.
Yeah, absolutely.
So it's more just, so you did your DCT, you had a mentor there who was really happy to help you. You were inspired by her. That's fantastic.
Yeah.
I mean, some people might not have somebody like that they can look up to.
Yeah, of course.
So at that first stage, how do you think somebody could find somebody that might be able to help a little bit more?
I think there's various ways. I think, for example, this week I stayed back after work to chat to a young dentist who wants to do prosthodontics.
Amazing.
And he reached out to me via Instagram. He saw me speak at an event in January, followed me on Instagram and slid into my DMs. And, absolutely happy to help. So I spoke to him for about an hour after work on Monday, which was lovely. And interestingly, he's done the same for a lot of people. He's really, sort of being proactive, finding out who's doing what he wants to do, contacting them. And most people are friendly and are happy to help. So that's one way.
So don't be afraid to just reach out to people.
And I said to him as well, if you want it, you've got to go out and get it.
Yeah.
No one's going to come and help you out. And there's a way of doing things as well. And, he was very respectful, really, really keen. And he was a pleasure to talk to and help. And, I'll always help him out if he does want me to. So I think reaching out to people who you think, they're doing what I want to do, and go for it.
And what did he say that... would you just help anybody out, or is there something that someone can say which might make you think, I don't really want to help them? Or, what is it that somebody should say when they're looking for a mentor?
I think so. He just said, "Hi, Fran. I saw you speak at such and such place. I'm really keen on doing prosthodontics, potentially at Guy's. Could I come and talk to you about it?"
Yeah.
And I was like, "Yeah, of course." Even if they didn't want to do prosthodontics, even if they just wanted to watch some procedures or just get advice, of course, still message. Most dentists love helping other dentists. And so I think getting in touch with people that you admire, I think, or on a trajectory that you're wanting to go on, getting involved in societies, I think that's really, really good as well. I haven't necessarily done that, but I think if I hadn't have gone down the hospital route, I think I would have gone to societies, networked a bit. But also in your local area, I think it's so important to find some experienced dentists in your area that do sort of work that you're wanting to do, or who you think would be able to support you. And so I think building up a referral network is really important. I see it with my two principal dentists that I work with. They work so tirelessly, and they're always on the phone to their referrers, always willing to help them out, always willing to discuss cases, bail them out if there's a bit of an issue. And that's priceless, I think. So I think it's just being brave and getting yourself out there and communicating with people. And most people are happy to help. And if they're not, well, so be it.
The biggest thing I got from that is that community is really important. You can't isolate yourself.
Absolutely. And it can be so easy to isolate yourself as a dentist. So many people are going through the same issues as you are.
And you find that out when you talk to people. Otherwise, you're never going to know.
Absolutely. And it's quite interesting. Where I work in London, there's already quite a big community around the practice. But I've just started working in Berkshire one day a week, and we're trying to build that community.
Yeah. How are you trying to build it?
So we're trying to do CPD evening, like free CPD evenings. Dent Supply have been really lovely and they've sponsored us quite a few times. And myself, just getting out there and networking and meeting new people. That's how I met yourself, which is so lovely. And actually, it's just been so positive and lovely. So yeah, just get yourself out there.
Yeah, I think that's a big message. So firstly, anybody that wants to kind of follow the steps that you're following, or any sort of speciality, so you don't have to reinvent the wheel. You can literally just go to somebody who's already done it, ask them what they did, and follow in their footsteps.
Absolutely. So, and I'm really lucky. I've got a lot of fantastic friends from Leeds. They're all specialists in different fields. I've got ortho, peds, special care, and they'd all be the same. They help others out. Yeah. So
guys, if you're looking to specialise in anything, just reach out to Fran and she'll pass you on to the right person. That's really good. And it's really nice that you have that attitude, because the more you give, the more you're going to get out of people as well.
Absolutely. And actually, I had an incident in practice where I've had to do a little bit of free treatment to help another dentist out, and which is fine. I'm absolutely happy to do, but it's happened a few times recently, and I just felt a little bit low about it. And my mentor was just like, Fran, what goes around comes around, and our colleague's really lucky that we've got his back, and we can support him in that way.
100%.
And he'll probably do the same for me one day as well. So it's it's constant community. Yeah.
Agreed.
Yeah.
And don't you feel like nowadays everybody has that kind of me mindset?
Yeah.
And everybody, well, I don't know about other careers, but in dentistry, because everything is very monetary.
Yeah.
So, you know, when you're helping someone out, you think, but what's in it for me?
Absolutely.
But sometimes it's not just monetary, like you will get the karma, or you will get, you know, the appreciation, and somebody will be willing to do the same for you.
Absolutely. And I think building each other up, the team overall will do better, and the practice will do better. And I don't like it when dentists just, you know, they work on their own, they're just worried about their own lists and, you know, quite selfish. Actually, that doesn't get you anywhere. I think it's really good to get yourself out there, work as a team, build a community.
So if somebody is wanting to follow this path, they should do DCT?
Not necessarily.
Okay.
Not necessarily. So the monospec training pathway is a little bit it's a little bit different. So I honestly, if you can do a DCT job, I do advise it. I think it's a great year. If you don't, it's absolutely fine. But I think if you do have the opportunity, I think it's great just to get yourself out there. It just push you out of your comfort zone. But yeah, doing a DCT job is ideal. All the usual, you know, sort of audits, clinical governance bits. But it's locally recruited now. So unlike, you know, your NHS reg training posts like ortho, oral surgery, peds, that sort of thing, for perio-endo pros, it's all you have to apply to the university directly. So you have to apply to King's or Bart's or the Eastman, and they decide on the recruitment. There's no national recruitment anymore. And because of that, we don't get a training number. So now technically you could do an MCLN in pros, and you could finish the pros MCLN and still not get on the specialist register. You're not automatically becoming a specialist anymore. So that's something to really consider. Most people will, but I know people who did the endo MCLN and finished the same year as me, and they're still not on the specialist list.
How do you get on it?
So it's all about, when you do specialist training, you've got to do something called ISCP. And you've just got to do things like DOPS, which is like supervised learning events. So getting critiqued by your consultant, watching you do a procedure or have case discussions. And you've just got to do so many of them each year. And it just shows the GDC that the training that you've had done and the quality of your work has been supervised, and it's considered to be at specialist level. Okay. And so you've got to do a certain amount of those, and you submit all your evidence to GDC on top of like lectures and audits and, you know, cases. And then they decide whether they'll put you on the specialist list or not. So, yeah. And obviously you've got to pay for it as well.
Yeah.
So you pay for the MCLN, and it's hard. You are only working part-time in practice. So for me, I was only working 2 days in practice and then 3 days in the hospital. So they're 3 days I'm not getting paid for, and I'm paying the privilege of being there. So it's a big undertaking. So yeah, that's my speciality training.
I didn't realise that's how it works. So that's really interesting to know. So just to go through the timeline of events. So you did you graduated with your BDS, you did your DFT, and then you did your DCT, and then straight after that, what did you do?
So I did actually apply for DCT, but a week before the interview, I remember getting my clinical governance notes out and just thinking, I can't be bothered. So I actually...
It's a lot.
I know. I withdrew my interview and I thought, I don't want to do this. I don't want to do a random... Because I thought I wanted to do restorative, and I just thought I don't love dentistry enough to do a random max fax job in a random area of the country. We just got a flat in London. I didn't want to, you know, go for the risk really. So I withdrew the application. I was lucky enough to get a 2-day oral surgery staff grade job at Guy's.
How did you get that?
So as I was a DCT there, you know, obviously they let us know that they're opening up applications for staff grade jobs. and I just applied for a junior role. Had an interview with 3 consultants and was lucky enough to get the job. And I loved the oral surgery department, guys. Really loved it. So I did that 2 days and then just 3 days in a mixed practice in Greenwich. So I did that for a year. And it's in that year that I applied for the prosthodontic implant, guys. But I literally put my application in the day before the closing date because I still wasn't sure whether I wanted to do it that September or not. But I just thought,
might as well.
Yeah. And then got the interview a week later, and I had a week to prepare for this interview. So it was quite stressful, actually. But again, I was put in touch with somebody who was already doing the course. So he was really kind enough to give me a call. I was on the phone to him for about 45 minutes and he just gave me a bit of a rundown about the setup and what to expect. So that was really, again, really, really helpful. And yeah, I got it.
How long was your MClindent as well?
MClindent's 4 years part-time.
Yeah.
So it's a long time. Yeah. So 4 years, you've got to sit various big exams at the end of the 4 years, pass them, and that's it, really.
And that's what you were saying, after you've done that, then you just send everything to the GDC and hope that you're going to be on the specialist register. And even if you're not, let's say, you're still going to have those skills, right?
Absolutely.
It's kind of a title.
It's an ego thing at the end that I want to, I should.
But well done for doing it. Well done for doing it anyway. I'm sure it wasn't easy. It sounds like you, the thing is, it sounds like you're saying you're really lucky, but it sounds like you've done the work. You've really put in the work and you've reached out to the right people. Even this person that you spoke on the phone to, there must have, you wouldn't just be sitting there and kind of hoping that someone's going to help you. You have to go out and get the help.
Absolutely.
Right? Say you're somebody that wants to specialise, maybe you're not going through exactly the path that you've gone through, but you're, say, a special interest, dentist with special interest, and you're in a practice and you've got other dentists there that you want them to send you work that will benefit you and make you more skilled. What do you recommend that they do? Like, how shall we speak to our colleagues and ask them to send us referrals, or how do we communicate that with the rest of the staff in the practice?
I think, again, it comes down to community, as we said. And I think having really good working relations with your colleagues, you want to feel like you're on the same team. And, the needs, because ultimately dentists do want to do as much work as possible, individually. But, so for example, I've got a couple of friends who work in general practice and they have this set up with the other dentists. They all get on really well. They do the endo, they do the pros work, and it's just building that sense of community is number one. I think you do need to do some further education. I think just being able to say, I'm really good at endo, I'm really good at this, doesn't really cut it. The majority of dentists are. I think doing further training, like doing an MSc or a diploma. To be honest, I don't even know. A diploma, yes, but I think you need something a little bit more than a diploma. I think do a diploma if you want to get really good at that. But I wouldn't expect referrals from other dentists, because if I'm going to refer someone, I need to be confident that they can really handle the case. So I honestly think doing an MSc or something of that level just demonstrates that further learning and deeper understanding. So I think.
What do you think about somebody that doesn't quite know what they want to do yet, though? So it's a lot to commit to an MSc.
Yeah, no, it is. Well, I think you just need to do a bit of everything. Honestly, try. If I didn't do pros, weirdly during BT, I got some one-on-one endo training, so it was quite funny. We had to reflect during our BT training on different cases, and I didn't have an endo disaster at all, but which I'm really grateful for. But I had one lovely patient, and we're not sure I had rubber dam on everything, but we think she might have tasted some hypochlorite. Not sure. took everything off. It was all fine, no biggie. But I reflected on it. So I called it. I was put on this special endo course for people in London.
So your patient doesn't taste like chocolate.
So they took all
that's
the...
good extra training.
Honestly,
I'll take it.
Well, that's from me being really honest. I was really honest about something that's, whatever.
May or may not have happened.
And I was immediately put on this endo course for all the sort of London trainees who were struggling with endo.
Okay.
And it was two lovely guys called Vish and Aaron.
Yeah, I love them.
Oh, they're amazing. And so Aaron, for one whole day, came to my VT practice to watch me do molar endo.
That's amazing.
Bless him, that must have been so boring for him. But because of the way they taught, I actually really started to enjoy endo.
Yeah.
And I thought... But the only reason why I didn't want to sort of do endo more, I just thought I've not been put on earth to look down root canals all day. I just don't think so.
It's not for everyone, but it may be for someone.
Absolutely,
so that's fine.
Absolutely. But weirdly, I honestly, someone, if I don't like doing it, I do shy away from it. But because I had a bit more work and experience at the endo because of Vish and Aaron and my VT scheme leader, I actually really enjoyed it. So I think you just can't shut away from anything. I think you've got to try and get as much experience of everything.
Yeah.
And then it might take you 2 years, it might take you 10 years. It doesn't matter.
It's not a race. Because who said there's like a age that you have to be able to do this stuff? I think that's one of the things as well with social media and all this stuff. We just see people that we assume either that they got there really easily. And that they got there really early on. But sometimes it's literally fine. There's no race and we're not against each other. No. If someone's done something young, great. But we've got 40 years of a career.
Absolutely.
I think we'll get where we want to be.
Absolutely. I think I was guilty of that initially to begin with. I thought, I need to do Invisalign, I need to do this, I need to do facials, I need to do all this stuff. And my brain combusted and I just thought, I'm not good enough, I'm not doing all this stuff, but so-and-so's doing it.
Yeah.
But actually... No.
Yeah.
I've got loads of years to do everything.
And if you change your mind as well along the way, because if it's 40 years of doing something, you might want to do something else after 10 years. And that's fine.
Yeah.
Don't you think?
Yeah, absolutely.
Yeah, so I think let's go on to that a bit, because I think people do struggle with finding their path or feeling like they need to find a path, because look, we already are dentists. Like we already graduated. That's like enough sometimes. And I just feel like people are really putting a lot of pressure on themselves to have an answer. So in terms of that, what do you think people can do to kind of just take it easy? Like, let's think of some practical things that we can do, because firstly, I'll give you one. Stop looking at social media and comparing yourself, because you don't actually know what this other person's done behind the scenes. Don't assume that everything you see on social media is good. Because there's probably 10 bad cases that you had before you put the good ones up. Right? So it's like taking selfies. You don't get the good one in the first try. It takes time. Yeah, so what do you think? What do you think of the fact that people are just putting a lot of pressure on themselves?
I honestly think social media, I know, is very beneficial for a lot of reasons, but I think the clinicians, unless you're, you genuinely love various dental accounts and you feel like you're learning from them, that's absolutely fine. But I think there's a lot of rubbish on dental social media as well. And I was very guilty of following loads of accounts and just feeling so inadequate. But actually, the thing that changed my mindset on it, in my central London practice, I got to see some cases treated by certain well-known dentists who are on social media. No shade at all, but I was shocked, really shocked. And I thought, wow, you cannot believe everything you see on social media. And they are just normal, like you and I. They cock up. They do great work as well, but, they're not perfect at all. And I was really shocked, because I just thought, oh my God, all these people are really perfect, and their practices are beautiful, and they're in this society or they're doing this. But actually, at the end of the day, you know, we are dentists, and for me, I go on the quality of treatment and the patient experience, and that's the most important thing. And I just thought, wow, okay, maybe social media isn't all it's cracked up to be. And so I've just set up a dental Instagram account, really
well
cringe.
Done.
But
it's not cringe.
It is cringe, but I've done it more, if I'm being honest, not to get patients, not necessarily to get referrals. It's more, I was fed up going to meeting of a dentist, predominantly older dentists who really underestimated me. I off it like get called nurses, which is fine, but it's just I'm not a nurse.
Yeah.
So I think it's just more for having some form of, you know, presence, you know, that, oh, Fran does this. But yeah, I think social media, I just think we should be on it less and less, if I'm being honest.
100%.
Yeah.
It's like it does more damage than good.
I think so. Yeah.
Unless you use it, unless you know how to use it in the right way. But I think with us, it's a new thing, isn't it?
Yeah.
It's only been around, like, say, the past decade.
Yes.
Past 5 years, it's been on steroids.
Yeah. It just started to take off when I was at uni, but it was we'd post really silly photos.
I miss that.
We were 2 likes. We didn't care. So luckily I didn't go through uni with the dental Instagram. I honestly think that would have crushed me if I had that going on at uni, because our career is so hard anyway. We don't need to have this external pressure going on constantly and this internal battle.
So true.
At the end of the day, if your patient's happy, you know, you treat them well, they're healthy, you're doing all right.
Happy.
Yeah,
just look after yourself.
Absolutely.
Okay?
Yeah.
I think that's the thing. So with your when you were at uni, that was the good times.
Yes, the good.
When I was at uni, it was getting to, like, people were making pages. I started my YouTube channel when I was at uni. Stuff like that.
Did you create your YouTube channel at uni because you felt like you had to do something to be, or did you? Do you see what I'm saying?
It was literally, so my friend Yuande, she started her channel, I think, first. And then we were just chatting about how hard it was to get into dental school. So I just started it because I was like, I have something to say. I want a voice.
That's lovely.
So it was not because of that. But I remember the first video I uploaded, I was like, how many views am I going to get? And then I got 1,000 views on the first day, and I was like, oh my God, I've made it on YouTube. But then it's just that thing of, like, when you upload stuff, then you're always, like, constantly monitoring who's watching and how many likes you got. So you have to be a strong person to upload stuff online, because it's not about, firstly, people don't actually care. They'll scroll past it and that's, like, it's not going to be on their mind all day. So the person who uploads the thing, they are, like, just obsessing, don't you think? I'm guilty of that for sure.
Before I posted my first case, I was showing it to so many people. I was like, is this okay? Am I going to get judged by posting it? Honestly, I genuinely said to my friend, am I going to look like a dickhead? Like, are people going to hate me? Like, Fran, no one cares. I'm like, okay.
Like, it's great work, but honestly, it's not on people. And the thing is, you do get people that might comment on it, or maybe, like, think it's bad or whatever, or, like, critique it. But if they're doing that, they really just don't have a life. That's what I would say. I think we have to just, if we're gonna upload stuff on social media, we have to detach first. Don't you think?
Absolutely.
Otherwise it's just not a healthy combination.
Absolutely. What else? Not getting too het up on social media, and honestly, just living your life. There's more to dentistry. And we discussed, I think that's something that I think I've been a little bit guilty of, because my training was so intense and work was intense. I was getting home 9:30 Monday to Friday.
Oh my God.
I was probably at the weekend stressing, doing some form of work for the training. So I've gone complete the wrong way. And when I stopped, I did sort of have a bit of a loss of identity. Well, I had an identity crisis. I thought, oh my goodness, what do I do now? But actually, there's so many things I love to do. And we were chatting, I've got so many gorgeous friends and family. And I think now I'm making up for lost time and just enjoying life and the simple things, and leaving work at work. a lot earlier.
100, you have to. And that's what I think. It's great that you're passionate about something, but at the end of the day, it is just a job.
Yes.
And it's not healthy, again, to take something home with you.
Yeah.
But it's amazing that you did that, you know, coming home at 9-10. That's crazy.
It is, but it's not healthy. But yeah.
That's, again, the point of this podcast is like, we are more than scrubs. It's great to get to that level where, you know, you love what you do.
Yeah.
But you need to do it in a way that is going to nourish the rest of your life.
Yeah, absolutely.
So on to that point, by becoming a specialist, have you been able to now you found your feet, have you been able to cut down the days that you're working or hours that you're working, and has it affected your income by doing that, or is it because you're a specialist you're earning enough to be able to supplement that?
Interesting. So actually, when I finished my training, I only worked 2 days a week initially.
Love it.
Which I loved.
Yes.
However, I could not afford 2 days a week. But I initially worked 2 days a week, and I did that for about 8 months. And then I've slowly built. So now I work 4 days a week.
Okay.
3 days in London, 1 day in Berkshire. I would love to work 3 days a week, but I can't quite financially yet. I think when you do the Emclin Dent, I honestly wasn't earning a lot of money. I'm sort of starting from scratch after the Emclin Dent. So I do need to work, unfortunately, like most people.
Yeah.
And the thing with pros as well, so it's interesting for a speciality. Prosthodontics, it's probably the coolest speciality in terms of some of the stuff you can do. However, in terms of being a specialist and working as a specialist, it's probably the worst. You're not going to get referrals. You are not going to be able to just walk into a practice and have patients booked in for you to see. Some people do, but it's very few and far between.
Okay.
Most prosthodontic cases are kept in general practice, and usually the more senior principal will see them, and it's only when things have really gone wrong that they might consider referring. So actually, I'm working in general practice. I'm just very fortunate that I work in one particular practice that gets a lot of referrals anyway for implant pros, and a lot of that's fed to myself.
Okay.
So I get to do the work that I've trained to do, but are they referring it to me? No.
Okay.
So you've got to grind and slog it out of pros. So if you did perio or endo, you could work 3 days a week. Just go in, you've got your patients that have been referred to the practice for perio endo or in-house referrals. And I think you have a nice balance. With pros, it's a little bit more tough.
And when you were working 2 days, what were you doing with the rest of your time?
So
you were saying it was just
I don't know. It was just filling it. It was just, I'm great at filling up a day off.
Yeah.
With absolutely nothing or loads. I love it.
Do you feel like that was too many days off? Like if you had to do that long term?
Yeah, no, it was ridiculous. But to be honest, in that period, I did my GDC application.
Yeah, I mean, all that admin.
Yeah, it
takes ages.
Yeah, so it took me a longer time to get my GDC application together, and I would say I've got friends and family all around the country, and in my last 2 years of my training, I really didn't get a chance to go and visit home often. I literally saw my dad 3 or 4 times a year in my last 2 years, which is disgraceful. So I was just making up for lost time, really.
Yeah,
so,
fair enough. You need that sometimes. And it's not, there's no rule where you just have to, we're very lucky in our professions that we can cut down our days or increase our days whenever we want to.
Absolutely.
So I think it's really important to take that little bit of a break. Like you work so hard.
Yeah. And look, I didn't even have the money to go on a nice expensive holiday or anything. I just try to get back into healthy routines, look after myself, go to bed early. So I just had a bit of a reset when I was working 2 days.
Need that.
Yeah, so nothing exciting, but that's that.
Okay. And now, is it Fridays that you have off?
I've got Fridays off.
Great.
Yes.
And I think that's nice.
I think
it should be like a legal thing.
4-day
work
I
week.
agree.
We need to sign a petition. And what are you doing on your Fridays? Is it still work stuff, or are you trying to stay away from work?
No, it's a bit of both. So last few weekends, I've gone to stay with family and friends, and I leave Thursday night, spend a Friday with them. So it's really, I've had sort of mini little breaks, which is lovely. But then equally, some weeks, there's we've all got a lot of life admin and patient admin. With working in sort of specialist practice, you can never go into autopilot mode. And a lot of our patients need letters. So I'm often catching up on my letters. Friday's usually just a bit of an admin reset sometimes, but then I often go to the gym on a Friday. I often meet up with friends on a Friday night. So yeah, balance. Balance. Absolutely, nothing exciting.
No, that's good. So we don't need excitement. We just need
I'm very
relaxation.
normal. Very normal and boring. Yes.
No, that's good. It's good. And then, do you think that it would make a difference if you worked 5 days versus 4 in a good way? Firstly, like in terms of financially.
Oh, financially.
Or do you feel like you can just compress it into the 4 days? Do you know what I mean?
Yeah, at the moment I can compress into 4 days. I don't, because look, you can have the same pot of patients in the same practice and work extra days. You'll have more time during the day, but you're earning the same.
Yeah.
So in my current sort of work setup, I don't think working a 5th day would help financially. I'd have to work somewhere else, but I can't be bothered.
Yeah, and then you would have to have another, like, where do you fit your admin in?
Yeah,
right?
And I've worked 5 days for a very long time, and I don't think it's healthy.
Yeah.
I've got some friends that work 5 days in practice, and I just don't know how they do it. But everyone copes differently. I definitely need a break at the end of the week.
I'm an advocate for that.
Yeah,
so
absolutely.
You don't have to justify it to me.
I used to have Mondays off, which I think is fantastic. I used to get so much on a Monday. Friday, I do sort of chill out a little bit, but it's fine.
That's great.
It's fine.
So one of the ways to prevent getting overworked or burnt out, I'm sure, is that you have that 1 day off in the week.
Absolutely.
Any other things that you do to stop from burnout and getting stressed and overworked?
Absolutely. I think sometimes I section my diary so I have a bit of admin sort of zoning, catch-ups with my treatment coordinator, so I feel like I'm on top of everything. And when I feel like I'm on top of everything, I can then just shut it all off in my brain. I get overwhelmed when I'm not on top of the admin, so if that means I need to block off an hour or 2 in the week to have a chat with my TCO and make sure we're on top of everything, 'cause that's what I do. In terms of outside of work, I see a personal trainer 2-3 times a week, and he's amazing, and he brings his little dog Louis, the Chihuahua, to the gym. So it's in a private room. So I have PT and Louis time 2-3 times a week, which is amazing.
That is nice.
Yeah, it's great. I'm really lucky. I've got an amazing group of people close to me, and I think it's just scheduling in some time each week to see them. Because during my training, I did a lot of revision and a lot of reading. I've gone complete opposite, and I don't read, and I'm not really I've not enriched my brain with other things. So that's something I need to look into. I think sort of learning about other things and my interests. I've got so many other interests that I've just absolutely quashed during the last few years. So I think it would be nice to pick up a book soon.
Okay, so how are you gonna introduce those interests back? Books or
I think I love a little podcast, so I think but I think maybe listening to some podcasts that have more of an educational benefit, self-care element. Some of the podcasts I listen to are really silly, but it's still good to switch off.
That helps you so much to switch
off. It does, because I think, again, I found this during COVID and lockdown, there was a pressure with work, but then I felt like if anyone had a hobby or did anything in their spare time, they had to excel at it and be amazing. And I thought, this is so tiring.
Can a girl just have a hobby?
Absolutely. Why can I just not have a hobby and be rubbish at it? But it just brings me joy. Exactly. I don't have to be amazing and post about it. And I think the silly stuff as well.
100%.
So I'm quite boring.
No, that's not boring. I think it comes to, look, you have such a high demanding job. You need to chill out.
Absolutely.
Otherwise you're gonna overwork.
Absolutely.
Your brain is going to be on overdrive. So listening to education. So I was guilty of this very recently. I burned out because after work I would listen to dental podcasts.
Yeah.
And I'm just feeling really stressed when I get home.
Yeah.
And I don't know why.
What sort of dental podcasts? Were they clinical or?
A bit of everything.
Okay.
But it was just dentistry.
Yeah.
And I don't know why, even at the gym, I would start listening to podcasts. And my husband would be like, what are you what are you listening to? He would take my headphone out and be like, oh God, she's listening to podcasts again. And then it just got to a point where I was like, what am I doing?
Yeah.
Because I'm just always stressed now.
Yeah.
And I'm always thinking about work.
Yeah.
So now I've done that 180 where I just listen to silly stuff or listen to girly stuff or self-care, whatever. But I don't want to listen to a dental podcast again. I'm done.
I've actually never listened to a dental podcast. Yeah, no. I know there's some fantastic ones out there, and I do
you get enough of it at work.
Yeah, absolutely. My sister once I got in really late, and I remember it was embarrassing, but I just put the Kardashians on at 10 o'clock at night.
Love it.
And my sister came in and was so appalled. Firstly, I was watching the Kardashians, but she was like, Fran, what are you doing? I was like, I just need to...
You need to watch
not think.
Trash. Sometimes you just need to, that thing that you just have in the background.
Yeah.
And not think about anything.
I like to decompress and not think. Yeah,
I think that's so important. So that's a great way to, prevent burnout. I agree.
Watch rubbish TV.
Yeah, why not? So just taking it back to when you qualified.
Yes.
Because we know that a lot of dentists struggle with a few things in the profession. We know that mental health is a big thing in our profession. Yeah. What do you think was the biggest challenge you felt when you qualified?
There were so many, but honestly, I just felt I wasn't good enough.
Yeah.
And I remember I struggled with it at Leeds a little bit, but I had great friends and lovely tutors, did all right. But I think I grew up in such a loving environment, very low key, quite a working class town. And then when I went to Leeds, it was the first time I'd been in quite a competitive environment, and it really didn't sit well with me. So I really struggled at uni, actually. So I actually felt quite low at the end of uni. And I just thought, why am I doing this? I don't enjoy it. I'm not good enough. And then when I did VT, again, came to London, a lot of London trainees, honestly, no offence, but some of them were quite confident.
Yeah.
And I just always remember on the first day, they would go around the room. There was 30 of us in our school. We were the biggest scheme in the country in East London. Where have you qualified from? How many surgicals have you done? How many molar endos have you done? And, some of the London lot were spouting out all these big numbers. And me and a couple of other girls that I grow close to, we were just like, oh my God. We're already behind and we've not even started.
It's not a good way to start off, is it?
Yeah, and that sort of theme carried on throughout the whole year. And it was a competitive... Yeah, I just constantly didn't feel like I was good enough. And actually I was doing fine, really, but I had quite a struggle internally about just the lack of confidence that I don't deserve to be working and treating these patients independently, because we get such little experience at university, really.
And it's so different to real life.
And I think if you really care and really want to do a good job, I just thought, oh my goodness, this is not adequate enough. I'm literally going to be drilling into this person's tooth and I don't really know what I'm doing. I thought at the time. Yeah. But what was lovely that year, there was a little group of us that sort of bonded, and we had a WhatsApp group. And I remember I posted on there, I took a bite wing of an amalgam I did, and there was a bit of an overhang. And I took a screenshot of it and I sent it to my friends, and I was like, girls, look what I've achieved today. And the floodgates just opened. And then one of them was like, well, look at what I did yesterday. And it was just all of our cock-ups. And we were just sort of like, oh my God, this is normal.
You can breathe. It's okay.
This is normal.
Yeah.
We all make mistakes.
Yeah.
We're not perfect. We've literally been qualified 6 months. And again, it's that sense of community. And so we just had a great giggle throughout the rest of the year because we found our community, and we found that, you know, we're not perfect. They might pretend they might be, but, you know, it's fine to make mistakes, and we're going to, it's okay.
Yeah.
And the patient will be fine.
100% agree.
Yeah.
I think it's a common theme between us all.
Yes.
And it is that competition.
Yeah.
Not competition, the, you know, feeling like you're not good enough, feeling like you're in a competition that you didn't sign up for.
Yeah.
And I think I can relate in terms of back at uni when, I don't know if you had this at your university, but when we had exams and we got our results, they would rank us. Did you have that?
Oh, no. That's awful.
Yeah, so there was only about 60.
Why?
Yeah, there was only 60 people in our year.
What was the point of that? I don't understand.
I don't know what the point was. It was literally just like soul destroying.
Yeah.
That was the point. I think they just wanted to destroy us.
Yeah.
And it would be like, so 60 of us. And I remember opening it and being like, oh, I got 31st.
Yeah.
Or I got 25th.
Yeah.
And you know, my goal throughout was to get top 10.
Yeah.
But like
that's
that,
how we always
like
have...
that matters.
Yeah, I know.
Like, why? Why
know.
does it matter? But we would, and it would be such a thing like, oh, did you hear this person got 5th? Or did you, you know, like, oh, they're so smart.
Oh,
What
it
can I
sounds
be
awful.
like them? It was awful. And I just like, you just reminded me when you said that, just the feeling of like not being good enough. But we all worked so hard to get here.
Yeah, absolutely.
Why are we still competing?
I know. So, and I think I was so shocked at that from when I started uni. Luckily we didn't have that.
Yeah, it's.
Oh my
I think
goodness.
they need to scrap that because it's honestly not okay.
The only thing they did do for us to get our finals results. So we always got our results emailed to us, but for finals, to find out whether we passed the degree or not, we had to queue up and go to a board. And there was a rumour, if you fail, they're going to whip you out of the line and take you away and give you therapy straight away.
Shame.
So queuing up, we're all sort of like, oh my God, are we going to get whipped away? Don't, like, no one come towards us. And then you've got to go up to the board, read it, and then walk past everyone again.
Lord. Yeah. Mate, just give me an envelope.
Yeah.
Honestly.
I want to open the envelope on my own in a room with no one there. Just give me a minute.
Yeah. I think it's crazy that. So it's kind of, they set you up for that competition to start with.
Yeah.
You're already a very high achiever by, you know, getting into dentistry anyway. So, you know, you've been competing that whole time to get in. And now you're in. I thought, after I got in, I thought, that's cool. Like, I can breathe now.
Absolutely.
But once you get there, you're like, everyone is so smart. Like, oh my God. Yeah, but people, like, we just, and the thing is, those people that got top 10, I mean, where are we now? Like, I don't think it matters. Do you know what I mean?
At all.
And in life, in the grand scheme of things, where does this fall into your, you know, where does it matter?
Does your patient care? No.
No, your patient cares if you're nice. That's literally it.
Yeah.
So yeah, I think that's really nice that we've spoken about that, because I'm sure that that's like a big thing that people feel.
I felt that still all the way through my postgrad training.
It never stops.
It never stops. My theory was I'm good with my hands, but I'm not an academic, and a huge part of the course was academic. And I had a battle internally because you've got to sit MPROS. The MPROS is a Royal College exam, and that's one of the criteria for the GDC to say, get on the specialist list. And it was always done at the end of final year. But of course, my year, they opened it up so you could do it a year early. So a few people in my year group did it early, and they were like, Fran, do it early, come on, do it early. And again, I was just, so it was stressful because they were all revising for the specialist exam, and that's a lot of the time that's what gets you through it. So I constantly, all the way from my third year, was just like, I'm so behind. But actually, I was just working really hard, getting great experience. And I was proud of myself, actually, because instead of just succumbing to the pressure and just doing it because everyone else is doing it, I did it when I was ready.
Good.
And, you know, you just got to stick to your guns. You know, there's no right or wrong. You just can't worry what other people are doing.
And again, those people that did it early, is there a medal now? Did they get a medal?
No, absolutely.
Are they somewhere different now where you haven't managed to get to?
Well,
that's what I mean. Like, we all just need to be a bit more easy on ourselves.
Absolutely.
I definitely think so.
Absolutely.
And so what My next question is,
Yes.
what message do you have for a dentist that might be feeling stuck right now? So they may have listened to this, it may have resonated, they may be like,
Yeah.
oh, that sounds like something like I really would like to do.
Yeah.
Or they're just feeling stuck in their current position.
Yeah.
Any message for them?
What I can advise is what I did. So when I was working in a mixed practice, I was seeing, it was mainly NHS,
Mm-hmm.
and I was plugging amalgams, doing big massive GICs, paying for my endo files to do an endo on patients.
That is criminal.
Yeah, I know, and actually making a loss because I was paying for a rotary
Oh
endo
my
file, but I just
gosh.
wanted to sleep at night, so I would do it. And I did feel really stuck. But what I did a course. I did the Chris Orr course that year. And that just broadened my horizon as to what parts of dentistry I like.
Yeah.
And from that, if I'm being honest, if there was a case coming up or there was potentially something coming up that I would like to try and excel at in the future, I would just book a little bit longer.
Mm-hmm.
I would take photos. I would take a hit financially with it because it was actually because I did that, I had a little portfolio. And yes, I wasn't doing smile makeovers or align bleach bond cases, but actually a lot of really good private practices want dentists who are really sound with the basics.
Yeah.
Yes, some practices do want cosmetic dentists who just do that, but I think that's really dangerous, especially at our point in our career. So I would just take photos of a crown prep, an onlay prep, a little bridge I fitted,
Mm-hmm.
a denture I fitted, and just some really simple things, but it just slowly built over time. And from that, when I did have an interview, or I suppose if you got in touch with a practice that you want to work at, you can show that. I just think if you carry on the way you are, you're not going to get out of that situation. So you do have to sort of, whether that's booking 30 minutes longer for a prep so you can take some photos, or if you're allowed to reduce the fee for something so that you can gain experience. I mean, we still do it now, I've just finished a really big case, and she spent so much money on the implants and the crowns, but she had all these awful old composites and caries. I said, look, if you don't mind, because this is a really lovely case for me to complete with you, I will do your composites for you free. And she was so grateful, and she actually wanted to pay me in the end. But if I hadn't have done that, I wouldn't have been as proud of the case. And it's something that I can use if I do a lecture, or it's sometimes taking a little bit of a hit and a sacrifice to further yourself, if that makes sense. So that's just what I did. And I think if you're feeling stuck, honestly, I think reach out to get to know other dentists in your area. And often I think if it's a nice practice or a nice team, they just want somebody humble who wants to do a good job. And if that's you, just build connections with them. And I bet you'd get a job with them, sooner rather than later.
You don't have to be stuck. There's always something you can do to
Yeah,
take your situation.
absolutely. Yeah.
But it's not going to happen if you just plod along and, just don't change anything.
Yeah. And I think, also, if you think you're just going to do a course and then get that job that you want, that's not going to happen either. And I think that can be quite disheartening. I think a lot of when I see young dentists in very nice jobs, I often think, how the hell have they done that? But I think they've just really got involved with that practice very early on. They might have shadowed, they might have done some work experience there, they might have contacted the principal for some advice on some cases, they might have met them at a society. It goes back to our initial point about getting out there and communicating with people. I think it's the same for this, if I'm being honest. And then also just taking a little bit of hit clinically with time and financially.
And that will come.
Oh yeah.
Like, don't worry.
And don't worry about money. You know, money will come. I honestly don't think about money.
No. The more you obsess about that, you're not really gonna kind of excel, because you're just too worried about, you know, cutting down your lab bills or not. You know, there's so many things that you can.
Well, whereas I'm doing 2 cases at the moment, and I'm taking a massive hit on the lab fee. I'm talking about a lab fee of £7,000.
Crazy.
But I'm doing something extra for my patients because, you know, it's a great outcome for them, but also for me as well.
Yeah.
And I couldn't justify asking them to pay an extra whatever £1,000 for this, but I'm taking a hit. I'm lucky because I work in a very understanding practice. I don't take a hit all the time.
Yeah.
But in certain, you know, even as a pros specialist, I don't have huge cases coming towards me all day, every day. So when a really nice case comes along, I still book extra.
Yeah.
I still take those hits. I still do things, you know, for free. We have a patient who I genuinely think is the worst tooth I've ever seen in my life. He's 44, caries everywhere, perio. And I've really undercharged him for restorability assessments. And I saw him again this week for 2 hours, and I assessed 3 teeth. I haven't put anything through. And, you know, some people think, why have you done that? But it's like, you know, this guy's coming on a journey with us. You know, his end fee is going to be humongous. Why not just help him out? And, you know, because if I charge appropriately for my time, you know, that could have just tipped the margin over the edge, and he might not have been able to take up the case. So I still do it to this day for some big cases. So yeah.
I think the end goal there is that you build up it's not just monetary, you will build up your portfolio in a way that it will attract more referrals or patients.
Absolutely.
And then you won't have to, you forget about the time that you...
And it's not me offering free treatments, because, you know, and again, as we go back to social media, a lot of these people that treat certain people, they've done it all for free.
Yeah.
And a lot of people don't realise that, or really reduced fee. And I know that for a fact.
You mean like models, like when they get somebody to post
Instagram,
about them?
Yeah. It's all, you know, and I find that that makes me a little bit uncomfortable. I'm talking about, it's not doing things for free, it's just taking a little hit here and there.
Yeah, but there's a gain there for you as well.
Absolutely.
It's not like you're just doing charity, because dentistry costs a lot. So even to your practice, it costs a lot for you to be in that chair, right?
Absolutely.
So it's not about doing things for free in that way.
No,
but it's about benefiting you, and yes, of course, your patient as well.
Yeah.
But it will benefit you in the long term, because you'll have something, you know, a great case to show.
Absolutely.
And you said that you lecture as well, so can you tell us a bit more about that?
Well, I'm just in the infancy of that. My practice, Darwood and Tanner, I'm so fortunate to work there. They're amazing. They're so forward thinking. And every year they have a study day. And I've spoken on the last 2 years, which has been really fun. Just a little short presentation on a case that I've treated or a subject. And I absolutely hate public speaking with a passion. I hated it all the way through uni, postgrad. But it's been really lovely because I've had some nice feedback about it.
Great.
But I do still find it quite stressful. But I feel the more and more I do it, the easier it becomes. So we did a CPD evening in Berkshire, which was really lovely. So I did that recently. I also I did a tutorial for some DCTs recently at Guy's, which was nice. And yeah, one of my colleagues wants me to get involved and do a bit of teaching with him, which is really lovely. And it's funny, I've never seen myself as being a lecturer or a teacher, because that sort of stuff normally strikes the fear of God in me. But it's just been nice that I've done little bits and people have been really supportive. So yeah, I'm in the infancy of it. We'll see what happens.
Yeah, but it's a great way, again, to use your knowledge, isn't it? And
absolutely.
impart it onto others.
Yeah, absolutely. And I think also it's just to inspire people that, you know, anyone can do anything. You know, I wasn't anything particularly special. And and I just think it's nice as well to hear and learn from people that, you know, are very understanding of what you're going through. And I think, unfortunately, I find not all people who lecture and teach in the UK, but I find a lot, you know, a lot of these courses, it's a bit of an ego trip for the, you know, the lecturers. It's a bit culty.
Yeah. But don't you feel like that's when you learn the least?
Yeah,
because
absolutely.
you're too worried about impressing this person.
So my friend, she did a composite course on someone who's an appears to be an amazing clinician.
Yeah.
And her take home from the course was the showboating of the other delegates, and, you know, to each other, and the competitiveness and their interactions with the lecturer, not the actual dentistry itself. And the courses are so expensive. She paid £2,500 for, you know, a weekend composite course, and that was her take home.
Yeah.
And I just find that so upsetting. So I do think there needs to be more legislation on who runs courses, but I don't know. Yeah.
We will be here all day to start talking about courses. But yeah, no, I agree with you. But it's nice that you're doing that, because again, that makes you you know, outside the clinic, you're doing something you love, and you're teaching people, and you're very approachable, so that's really nice. And I would love to listen to your lectures as well, because
we'll see.
You know, we need somebody who is a bit less, like you said, showboaty.
And you know, just keeping it real, I think.
Yeah, exactly. So my last question to you is, if you weren't a specialist dentist or a dentist, what would your dream job be?
Oh, so actually, I was really rubbish at biology and chemistry. And I really struggled with it. I did dentistry because my dad's a doctor, mum's a nurse, and, you know, I just thought that was a good path to go down. I was so good at art, and so me and my best friend, we actually got the top 5 marks in the country for A-level fine arts. Yeah, I loved it. And I want to go to art college, really. So I think if I didn't do dentistry, I would have done something absolutely completely different. I would have done art college foundation, and I really want to do something in fashion.
Okay.
I know it's very, you know,
typical,
but yeah, I love fashion, I love art. It's something I'm actually more passionate about that than dentistry. Interesting. I did do a little short course at London College of Fashion about 5 years ago. It's good. But I did handbag design, and I don't know why I did handbag design. I want to just get back into sewing, and I think I just want to learn some basic skills.
That's amazing.
And then build on it. You never know. But I just find it so much more fun and interesting.
And like we said, it doesn't have to be, you know, you go into fashion and now you have to become like really good at this and sell your products on Etsy.
Absolutely. My dream is that I could just, there's so many ideas. When I'm looking for a dress or a top, I just think, oh, why don't they just make this?
Yeah.
I'd love just to be able to make my own clothes.
Oh, I love that.
Yeah,
That's so nice.
Not profit from it or anything, just for me.
That ends us nicely.
Yes.
And I just want to put a message out there that we are all more than scrubs. I know that dentistry is important, our careers are important, but what's more important is the rest of our lives, our mental health, our physical health, and our hobbies, like you said as well. Yeah. So any final messages from you?
I think that was so beautifully. I don't think I can add anything. I think, yes, my career, when you look at it from the outside, it's quite wow, how's she done that? But, you know, I have sacrificed a huge amount, and, you know, mentally, physically, and it's actually not healthy. So yes, I've achieved a lot professionally, but that's been to the detriment of me personally at times. And I think, you know, again, when you look at the outside in, you know, you just have to remember that. So you are doing really well. Always remember that you're on your own path and journey, And I know we say it, but just please do not compare yourself to anyone.
Yes, and work at your own pace.
Absolutely.
There's plenty of time.
And reach out to others and learn from them, and, you know, just build a local support network. It's really important.
I love that. Thank you so much for coming. And it's been so nice to speak to you.
It's my pleasure.
And I am sure that everybody who's listened is really going to benefit from this one.
I hope
so. Thank you so much.
Thank you, Coral.